good afternoon and a warm welcome to our science seminar. This time on the findings from PARC on the implementation of REACH and OSH measures at the workplace. The presentation will be presented to you by Piia Taxell. She will be with you shortly. But before we dive into the content, I wanted to all share with you all that this seminar will be recorded and that the recordings will be shared on the ECHA website after the meeting. The discussion that we aim for after the presentation by Piia will not be recorded and will also not be shared on our website. This to make sure that we can all openly exchange on the difficulties and potential benefits of REACH and OSH measures at the workplace. So thank you for that. We aim for an interactive, lively exchange after the presentation. So please feel free to intervene with whatever question you may have that you would like to exchange on. Please take the opportunity to exchange with Piia. In case you have any questions during the presentation, also feel free to use the chat. We will then only come back to those after the presentation. If you want to intervene, please raise your hand. And after you've been given the floor, you can open your microphone yourself and then also close it again after you're done. So thank you for that. Just a reminder also that ECHA does not endorse any of the views that are presented today. And you will all be given a feedback survey after the seminar where you can give your views on how the seminar was organized, its content, and also where you would like to see improvements in the future. So with that, and for you that, for those of you who may join the science seminars for the first time, early 2025, ECHA started organizing these science seminars to allow for the opportunity of an active exchange between scientists from outside ECHA and ECHA experts on newly developed scientific results to better allow implementation of those results in our daily regulatory work. So that was the background for our science seminars. We have topics both addressing human health and environmental topics. And the idea is really to have an active discussion and exchange between all of us. So on today's science seminar, this seminar is set up against the background of an ongoing learning process on how to best use the regulatory tools provided by us or to us in REACH and in OSH to protect worker health. There is a lot of discussion ongoing and has taken place on the legal possibilities of both regulatory tools, also on their possible weaknesses, and then the actual practical experience on how these tools work out in practice is only coming available now, with also the more experience of REACH restriction, for example, and authorization processes, and the work that Piia did contributes to this further insight. So Piia Taxell, she's a senior specialist at the Finnish Institute for Occupational Health with nearly 20 years of experience in assessing risks from chemical exposure to workers. She participates in the several expert groups, the Finnish Advisory Committee for OELs, the Advisory Committee on Chemicals in Finland, and then also on the Nordic Expert Group for Criteria Documentation on Health Risks from Chemicals. She plays an active part in PARC, looking at occupational health issues, and she's also involved in activities related to chemical preparedness. With this very short introduction into her person, I would like to give the floor to you, Piia, to present us the work that you did over the last 3 years. Thank you very much.
Yeah, so as Fleur mentioned, the aim for today's seminar is to discuss the findings of a case study we did under the PARC project. And we have done this work together with colleagues from Finland, Sweden, Latvia, Norway, and Slovenia. Really nice working group. And we completed this case study this year, but we are still waiting for a scientific article and the project report to be published. So we are hoping that early next year we will also have the publications available. So by then, this is a kind of a taster of the results. So the motivation for this case study was actually the current situation where occupational chemical exposures in the EU are regulated both under the OSH legislation, mainly by setting occupational exposure limit values under the Chemical Agents Directive or under the Carcinogens, Mutagens or Reprotoxic Substances Directive, but also by REACH authorisation and restriction requirements that address specifically occupational exposures. And our kind of hypothesis was that when the requirements come from these different regulatory processes, there might be differences in how they are interpreted and implemented at the workplace level. And we also noticed that there are currently no clear guidelines for selecting the most efficient regulatory option for a specific case. So the main aim was to clarify how these occupational exposure limit values, which come from the OSH side, and on the other hand, the REACH authorization and restriction requirements, how they impact the workplace chemical risk assessment and risk mitigation in practice. So what we did, we had a regulatory review where we went through recent case examples on how occupational chemical exposures have been regulated at the EU level and made some remarks from these case examples. And then we had a questionnaire study for labor inspectors and for company OSH managers in 3 industry sectors. And we addressed awareness of workplaces on OELs and REACH requirements, the impact of these requirements at the workplace level, and potential challenges the workplaces have faced when implementing these measures. And we also did interviews with labor inspectors and OSH experts, mainly from companies and also industry and labor organizations, to have a possibility to have a kind of a more in-depth discussion on these issues. And the questionnaire study and the interviews, they were carried out in 4 countries. So Finland, Norway, Slovenia. And they were really addressing OELs and REACH requirements in general, so not limited to the case examples we had in the regulatory review. So for the regulatory review, we chose 8 case examples, and the main criteria was that the substances or substance groups should have a quite recent EU-level OEL, and also preferably some occupational exposure-related regulation from the REACH side. For hexavalent chromium compounds, there is an binding OEL. which is currently under review process, and this OEL applies to all the compounds and all exposures. But there is also authorization requirements and the recent restriction proposal which address certain hexavalent chromium compounds and uses. For nickel and its compounds, there is a binding OEL for nickel compounds, but not for the metal itself. And for lead, there is binding OEL for the metal and the compounds, and also binding biological limit values, and then there are restrictions for certain uses. And for cobalt and cobalt compounds, there is an OEL proposal that address all the compounds and exposures, but there was also a restriction proposal for certain cobalt compounds, which was then later withdrawn. And for arsenic and its compounds, there is OEL that covers certain compounds, and there are also authorization and restriction requirements related to certain compounds and uses. And for these aprotic solvents, NMP and DMF, there is binding OEL, but there is also restriction where a limit value also comes in. And then finally, we looked at diisocyanates, where we have an OEL that covers all the processes, and then there is a restriction that requires training of employees that also covers all the compounds. And from these case examples, we noticed that for the hexavalent chromium compounds and for these aprotic solvents, there is a clear mismatch between the OSH legislation and the REACH requirements, in the sense that they require different, or they allow for different level of exposures, and thereby require different level of exposure control. And this is, of course, it's both of these regulations are in force. This is not kind of a desirable situation to have a regulation which is not in line with each others. But this was one remark from these case studies. And also the situation might be the same for those cobalt compounds, but in those cases the restriction was withdrawn as said. So this might be a good thing when considering coherence of the legislation, that there is now only the OEL and not a restriction that puts in limit values. And then some remarks from the review. It was quite evident from these case examples that the strength of occupational exposure limit values is that they cover all the exposure situations, including those process-related exposures, which might actually be quite important. And this was, I think, emphasized in our case studies, since we had several metal compounds, and for metal compounds, especially the occupational exposures that relate to processing of metals and metal manufacturing, which fall out from the scope of REACH, they are very relevant. So OELs fit quite well in regulating the exposure of metal compounds. But we also noticed that the OEL process is challenged by its division under these two directives based on the hazard classification. For example, there is the binding limit value for nickel compounds, but we do not have a limit value for nickel metal, although the basis for the limit value would actually be the same. And this is just because of the different hazard classification. And the situation is actually the same for arsenic. And one characteristic of the OELs is also that if if they fall under the CMRD directive, they will always be subject to socioeconomic assessment. In certain cases, this has led to a deviation from the health-based level. So the limit value was set higher than it would have been if considering also only the health considerations. This was the case, for example, for nickel compounds and cobalt and its compounds. And the REACH authorizations and restrictions, they were in certain cases more ambitious on their level of protection, but they cover only those specific compounds and uses, so they are more limited in that sense compared to the OELs. And as said, there are cases where the REACH requirements are not in line with the OELs, and which is kind of an inconsistency in the regulation. But there were also cases where the OEL and the REACH requirements were more complementary with each others, and one of those was the diisocyanate case, where the exposure levels are regulated by OELs, but then the restriction brings in the mandatory training requirements. So these go together quite nicely. Some highlights from the questionnaire study with labor inspectors. We were asking about the general awareness of workplaces on OEL updates and REACH requirements. And most of the labor inspectors in all these 4 countries were in the opinion that awareness is average or even poor, both on OELs and on the REACH requirements. And they have seen OELs and REACH requirements to trigger measures at workplaces sometimes or seldom. And if measures were seen, then they were usually for OELs and REACH authorizations, updates in chemical risk assessment, and exposure measurements. For OELs, quite often also improvements in technical exposure control. And then for REACH restrictions, mainly training of employees, which may relate to the diisocyanate restriction that requires training. And challenges related to the implementation of OELs and REACH requirements at the workplace level was mainly reported to be related to the lack of knowledge of these requirements in the companies, and also lack of knowledge on chemical safety in general. And this is especially for the smaller companies. And also lack of resources to follow the legislation or to implement the measures. And this is also especially for the smaller companies. And the labor inspectors found, or most of them found OELs to support their work. And some of them also considered that REACH requirements support their work. And for OELs especially, they mentioned that OELs provide kind of an objective reference point for evaluating the adequacy of the exposure control measures at the workplace. So a useful tool for labor inspectors as well. And about the questionnaire study to company OSH managers. So this was chemicals industry, metal industry, and motor vehicle maintenance and repair industry included. So we asked about the most important information sources on OEL updates and REACH requirements. And it was clearly the safety data sheets and chemical suppliers, which were the key sources of information. Also, part of the mentioned national authorities and ECHA. And in Finland and Norway, where there is mandatory preventive occupational health care and quite strong system to support this, in those companies, also occupational health care was mentioned as an important information provider. So even though we have in these results combined all the countries, this peak for occupational health care actually comes almost only from Finland and Norway, where this strong preventive health care is in place. And these companies, which were eager enough to respond to our questionnaire, they reported quite large variety of measures triggered both by OEL updates and REACH requirements. We take a look of these just in a moment, a bit more detail. But they also identified challenges in the implementation of these measures, and most importantly, technical challenges related to reaching those exposure levels which are required, and also lack of information and knowledge. So they also self-recognize that they would need some more know-how and information on these requirements and how to implement these. And also they reported that they would like to see better quality safety data sheets. They found better information flow in the supply chain of importance. And this is, of course, very well understandable when looking at the most important information sources. So if there are some challenges in the information flow, it might be that it never reaches the workplace level, that there has been some changes in the regulation. They also would like to have clear instructions from the authorities, and also related to the supply chain communication and training. So they recognize that that knowledge and information is missing, and they would like to know more about these issues. So these are the measures the companies reported that have been triggered by OEL updates. So most often updates in chemical risk assessment, training of employees, but also exposure measurements and changes in exposure control measures. And for REACH authorizations, they reported most often also updates in chemical risk assessment, training of employees, but then also substitution of hazardous chemicals and processes. Also these other measures, but those were the top 3. And then for REACH restriction, training of employees was the most often reported measure. Also updates in chemical risk assessment. So it seems that any change in the legislation related to a substance will make the companies to check their risk assessment related to that substance. And this is, of course, very, very nice finding. So they are really paying attention on those chemicals on which there are changes have been made in the legislation, either updates in OELs or new REACH requirements. But also substitution of hazardous chemicals and processes was quite often mentioned related to REACH restrictions. And one additional thing from the OSH manager questionnaire study I would like to show you relates to exposure measurements, since we had kind of a background questions related to risk assessment and exposure measurements. And measurements are, of course, very important for showing compliance with the regulation, but also to support risk assessment. So it's very difficult to do that throughout risk assessment without measurements. But from this question of other responses, we very clearly see that the larger the company, the more often it carries out measurements for evaluating the exposure of the employees. So yeah, so it would be also important to somehow increase this measuring also in the smaller companies to support the risk assessment and also to showing compliance. And from the interviews, it was very clear from both from the labor inspectors and from the OSH experts in all these 4 countries that there really is a wide variation in the awareness of both on OELs and on these REACH requirements between companies. And the awareness might be quite low in small companies down in the supply chains, even non-existent knowledge. And on the impact of legislation, OELs were considered to support exposure and risk assessment and also to support inspectors for demanding this. Whereas the REACH authorization and restriction requirements were considered to promote discontinuation of use, so to promote substitution. And the factors that hinder the impact of legislation, both OELs and REACH, is the lack of resources and competence in the companies. And the inspectors in special mentioned the inadequate level of basic chemical safety. So it's very challenging for them to start discussing OELs or REACH requirements if there are no chemical list available at the workplace, safety data sheets are missing, or there is even not a basic chemical risk assessment made. So they consider these OELs and REACH issues to be kind of a next level discussion, which they may not ever be able to reach with the smallest companies. Complexity of the legislation was mentioned as one challenge. The OSH expert considered that it's challenging even for them, for the experts, to follow the legislation, and they were really considering how it's possible to stay updated especially in the smaller companies. And difficulties in the supply chain communication was also mentioned, especially by the OSH experts. And the labor inspectors especially brought in the availability and quality of expert services, so occupational health care and consultancy services. And they found that it's really important that those service providers have the knowledge to be able to support the workplaces. So they were thinking that training of those expert service providers would be a quite important issue, and also otherwise to pay attention on the level of knowledge of these service providers. And the other experts called for a consultative attitude from labor inspectors. So they would really like to see inspectors to help them with these quite complicated issues to have this legislation implemented. And then some conclusions from this study. It seems that there is still some work to be done with to improve the coherence and simplicity of the legislation. From this study, it seems that OELs fit quite well in regulating chemical exposures to specific levels. also to support exposure and risk assessment. And REACH authorization and restriction requirements, on the other hand, they support substitution. So this might be a good option when the aim is to discontinue the use of a substance. And they are also good in bringing in complementary requirements, such as the diisocyanate training requiring restriction. And also the diisocyanate restriction was several times mentioned by the interviewees as improving the supply chain communication, because it requires the chemical providers to communicate with their customers. So it also improves this information flow. So interesting regulatory tool also in that sense. Yeah, and this was not surprising, but still quite striking that it might be that OELs and REACH requirements actually have less impact in the smaller companies where the baseline level of chemical safety is lower, even though most probably in these companies the need for improvements would be higher than in the larger ones. So this is an issue that we think that needs to be considered and somehow tackled. And improving safety data sheet quality and changing the supply chain communication would be important, because these were the key information sources reported by the companies. And also it might be that it would be, or there might be a need to develop the inspection practices to better support the implementation of legislation at the workplace level. So with these conclusions, I could end my presentation, and thank you for your attention.
Thank you very much, Piia, for this very interesting story and all the different surveys that you conducted and the answers you received. There's definitely many things that are interesting for us to further consider. So with this, thank you very much, all of you. Big applause, I get, at least from here in the room. And hope to hear you in the future. Thank you.
Thank you very much. Thank you. See you.